another wonderful day. Seems everything's going our way. Every time.
What I'm doing this on is blood work, and why is it important? I look at more things than just musculoskeletal, okay? So basically what I want to make sure is that not just that you're in alignment and that your muscles are not tense and whatever the case may be, biophysical, biostructural conditions, but also that you as a whole, holistically as a person, are in alignment, so to speak. So it's all important. If I were to just have you come in and give you an adjustment and send you on your way without addressing any muscle spasms you would have, for example, you would walk out into the parking lot, okay, and likely go right back out of place because we haven't fixed the muscle spasm, which is causing you physically to be off kilter, so to speak. On top of that, if we don't address you nutritionally, and look at your blood work as well to see what's going on with you physiologically, we're not treating you holistically. Take a look at this. So for example, with this particular patient intake form, I just have people fill out what's going on with you overall, okay? And this particular patient has a whole host of issues, which is kind of why I picked her, even though she told me, but I'm here for back pain. I don't understand why I have to fill all of this out. Well, it's all very, very important, actually, as you'll see in just a moment. So this gives you an idea, indication of what we do and what we're looking for. Then the next page is, well, are you on any medications or supplements? Well, yes, she is. So it's no wonder that she feels dizzy or constipated or doesn't feel very good. And if you go through, whenever you have more than 3 medications, it's really very, very difficult when it comes to pharmacology to be able to predict what those things are going to do. Here she has, oh, I don't know, 15. Okay, so a whole host of issues that go along with that. And each one typically has a side effect. For example, the very first one can cause dizziness and headaches and sleep deprivation. And if you look at the symptoms that she has for part of what, you'll see a lot of these things start coming up. She has osteoporosis. Well, number 2 creates bone weakness. Dizziness, she's depressed, she's on Zoloft. The third one creates depression. Okay, and the list goes on and on and on. So basically what chiropractic interns do is treat you holistically, the person as a whole, and without the use of pharmaceuticals. Blood work also for analyzation comes into play, which is page 3. Is this important? So why does a chiropractor need to look at your blood work? Well, I asked her, I said, have you had recent blood work? Oh yes, I have. My doctor told me it was fine. Well, just for giggles, how about you have him fax it over to me, and we'll take a look at it. I won't charge you for it, it'll be fine, we'll just make sure everything's okay. Page 1, red blood cells, low. Hemoglobin, low. Hematocrit, low. But she's fine. Low red blood cells, she's a quart down. She's a quart low with blood, so to speak. Well, why? Her primary care physician said that's okay. Anybody have any clue why you might be low with red blood cells? Or blood?
Infection.
Okay, not a bad guess. That would affect more your white blood cells, but you have a leak somewhere. Okay, so she also has a heart condition. Her physician has her on not 1 but 2 different types of aspirin. If you do the most current research, guess what aspirin does to your intestines? It thins out your blood, and also a lot of times will eat at your intestines and cause some compromise of your intestinal wall and cause bleeding. So it's like I said, she's a quart low, so at the very least she's anemic, and she may have an internal bleed someplace. Then the next one, hemoglobin. What's going on with that? Iron deficiency. She might have parasites, sometimes adrenal hypofunction, cancer, hematocrit, thymus, hypofunction. Right from the very first page, low, low, and low, I'd like to see a reticulocyte count. what is going on with this individual's red blood cells? And again, according to a primary care physician, I'm not putting anyone down. We should all work very cooperatively together. Everybody has their place, but something is not quite right. You don't need to be a physician to be able to see this. You can come in if you want.
Hi.
Now, if you go to page...
It's okay. I'll stand right here.
Okay, you can go to page 2. Now, mind you, she didn't even want to fax these because her doctor said, we're good. They said everything's fine. 1, 2, 3, 4, 5. High, high, low, high, low, high. Really? Everything's fine. Well, we have an increased BUN or BUN. So renal dysfunction, there could be white blood cell infection increasing that. Her bicarbonate is up, her BUN creatinine is up, her AG ratio, all of this technical terms. But basically you can see something's going on here. She's not honky-dory, right? Turn over to the next page. How's your bone density? So I asked her about her DEXA scan. Most women will know about a DEXA scan. It's the test, how are your bones, basically. Do you have osteoporosis or not? In this particular case, she does. Now, is it caused by what is going on? You look at the blood serum levels, and then you figure out why. So the blood kind of doesn't lie to you. It gives you a more accurate picture of what's going on with somebody physiologically, and you can't really hide from it. So that's why we look at the blood. And then from that, what I'll do is go and give you what are the deficiencies that are caused by the lack of this? What do you need to take to correct it? So that in a nutshell is why. What we do as chiropractic internists is look at your blood levels, and there's usually a range that you'll see between this and this. And what we do is look at the ranges a little bit differently. For a medical doctor, those ranges, if you're outside of it, indicate a pathology, meaning something's happened, you have some sort of disease going on that needs to be addressed. Well, what about if it's right at the bottom rung of low, or right at the top rung of high? And then you have something way down here and way up here, but within norms, but for some reason you just feel like not optimal.
And then
Okay, which is why we will look at what they call optimal levels versus the ranges within normal range. Because you certainly don't feel normal or you wouldn't be coming to the doctors. What can a chiropractic internist do? We can either treat or co-manage things like diabetes. Okay, so you're not way out of norm. If you are and you're on insulin, then we may need to co-manage you. If you're somewhere at the bottom rung or the top rung, then a lot of times just through supplementation we can help you. Sciatica, hypothyroidism, weight issues. Well, why do you have a weight issue? Would be the first question that I might ask. Overweight, underweight. But if you look, for example, on page 2, it will give you what an MD or a medical community considers as the healthy range, meaning not in a disease state, but once you set foot outside of that, that's when the disease state starts. So we don't want you to get to the disease state. We would like to address these things before you get sick, which is why we look at the blood work. I treat humans, of course, and oftentimes their pets. And I've had some amazing results with that as well. I have one patient, her name is Carol, her last name will remain anonymous until I get in writing that I'm allowed to disclose it. But at any rate, she came to me, I've been treating her with great success, and she said, you know, my dachshund is having some issues. Do you look at animals? And I said, as a matter of fact, I do. I said, what's going on? She said, well, she can't move along very well. She can't go up steps or down steps or, jump up on the couch. She just seems to be just in a lot of pain. And I took her to my vet, and my vet told me that they recommended back surgery. So before I do that, I just thought I'd give this a shot. And I gave her dachshund 2 adjustments, and she's fine. And I mean 100% fine. I said, did you tell your vet? She said, no, I haven't. But she goes, watch this. And she's like, come on, come on. And she jumped up on the chair and back down, which I don't really recommend things up and down from heights for the dachshund. There's more strain on their back, but perfectly A-okay and hasn't had an issue since. So I'm sure the dachshund is happy that they didn't have to undergo surgery. And sometimes it's necessary. I'm not saying that I can,
Miracle worker.
No, I'm not a miracle worker, but in this particular case,
It worked out.
it worked out well. Yeah, and everybody was happy.
It's just another wonderful day. Seems everything's going our way. Every time I see you smile, you make my life worthwhile. It's just another sunny day with you.